to your health. Joining me today is Dr. Lorraine Maida, a functional and integrative medicine physician who practices anti-aging medicine, executive health, hormone replacement therapy, and weight management. She's the author of Vibrance for Life, How to Live Younger and Healthier. Dr. Maida is here today to discuss the effects of insulin. Welcome, Dr. Maida. Thanks for joining us.
Thank you so much for having me, Joan.
Dr. Maida, I know that insulin is used to control diabetes. However, I'm hearing that in non-diabetics, it can be a problem and lead to weight gain. Can you tell us more about this?
Absolutely. Well, you're right. Insulin is used to drive sugar or glucose into the cells to be burned as fuel. But whatever is not burned, insulin will signal the cells to store that unused, unburned glucose as fat. And fat cells release chemical substances called cytokines. Cytokines signal inflammation. And the more you eat sugar and processed carbohydrates and starchy foods and alcohol, if there's an excess and you don't burn it, the more insulin you're going to make to drive that stuff into your cells to be burned, and what's not burned is going to be stored in fat. And it has to get the sugar out of your bloodstream. That's why it's stored as fat, because sugar in your bloodstream, too much of it is going to bind to protein all over your body.
So, Dr. Maida, most people get their annual physicals and they get their sugar checked. And if it's in a normal range, does that mean that they don't have to worry about being insulin resistant?
Not at all, Joan. I see people every day and I measure fasting insulin in almost all of my patients. And I see people with normal to sort of high normal blood sugars, and it's often overlooked. But then when I look at their insulin, if it's high, they have problems. And almost everyone who has high insulin has some kind of issue, whether it's weight, fertility, polycystic ovarian syndrome. Some have outright diabetes. Some have just dysregulated sugar. But it's a problem. And the number one problem of being insulin resistant is weight gain and obesity. That leads to chronic inflammation. Like we said, they release the cytokines, and it becomes a vicious cycle. The more insulin you make, the more you need to get the same effect. And it's just like alcohol is to an alcoholic. You need more and more and more, and it's just not doing its job. Understand that inflammation is the root cause of almost every illness. Everything from allergies, arthritis, asthma, autoimmune disorders, cardiovascular disease like high blood pressure, diabetes, cancer, and, you name it, anything with an itis, it's inflammation, and it's going to cause big problems. And the other major problem with insulin resistance is it's what's called metabolic syndrome, and that's a constellation of symptoms and issues: high blood pressure, high blood sugar, high triglycerides, increased waist circumference, and fat gets stored in all your organs, like your pancreas and your liver, and you get non-alcoholic fatty liver disease. So your liver detoxifies things, and if it's filled with fat, it's not going to work well. And if your pancreas is filled with fat, over time, it's not going to work very well either. And these are organs that are essential for your health. And another less well-known disorder that's root causes is high insulin and insulin resistance is polycystic ovarian syndrome. Women don't ovulate. They can't make progesterone. They gain weight. They make too much testosterone. They get hair on their bodies. They lose hair on their head, and they can't get pregnant. I'm seeing more and more of that, and it's all rooted in insulin resistance.
So, doctor, these consequences sound serious. Is there anything that we can do about this to prevent it?
Absolutely, Joan. There's so many gradations of these disorders. So first and foremost, you measure, because if you don't measure, you don't know you have it. Low glycemic diets are the best for people who have high insulin, and that means, how fast does your body absorb sugar? So you don't want processed foods or sugary foods. You want to make sure you avoid these, and, starches or sugar. So a low carbohydrate, low glycemic diet is good, and vegetables are wonderful, protein is wonderful. If you're overweight, sometimes I do a whole metabolic reset where I limit the carbs and I limit the processed carbs and the simple carbs, and I limit fat. And that can turn around insulin resistance like crazy. It's amazing to see somebody drop from 30 to 7 in, just, a few short weeks. The other major factor is exercise, because you want to burn all that glucose. You want to make your cells more responsive and less resistant to the insulin. So the diet, the exercise, and then supplements like fish oil, alpha-lipoic acid, berberine, chromium, vanadium, and even cinnamon can be helpful. But be careful if you use cinnamon on your food, because you want to use the Ceylon cinnamon, Ceylon. This is the cinnamon that works better. The common cinnamon that's sold on the shelf, unless it says Ceylon, is usually cassia. And cassia can contain high levels of coumarin, which is a natural ingredient that, when eaten in large amounts, it can cause some liver toxicity that's reversible when you stop it. So there are a group of individuals that are sensitive to it, and I would always look for Ceylon cinnamon.
Lorraine, thank you so much for joining us. If you would like to learn more about Dr. Maida and her work, you can visit her website, howtoliveyounger.com. And as always, to hear more from Dr. Maida, you can visit our website, cyacyl.com/Lorraine. We'll be right back.